I'd like to welcome Emily Price to the podcast. She is a doctor and she's an obstetrician and gynaecologist, and we are going to talk about how fluid or how you can feel fluid in your body after a pregnancy loss. So thank you so much for making the time to come here.
Well, it's a pleasure, Peter. Thank you for having me, and I'm looking forward to having a good chat today.
Yeah, so we just wanted to talk about, these are things that sometimes people don't register are happening, but we have had quite a few women talk about the fact that they need to pee more or they're feeling fluidy or just a bit more bloated than normal, and we don't really talk about it, so it'd be really good to just explain why that's happening and what symptoms women can get, noting that not everyone gets these.
Yeah, absolutely. I think that you've highlighted a really important topic that, as you said, no one thinks about or talks about very frequently, but is experienced by the majority of people who are pregnant or experiencing a pregnancy loss. I think that the important thing to say is that as soon as a person is pregnant, there are hormonal changes that affect the fluid balance in their body to facilitate a growing pregnancy, and those changes in the event of a pregnancy loss need to be reversed, and that'll happen at a different rate for everyone.
And some of those fluid changes, like we actually nearly double our plasma volume even in early pregnancy, so that just doesn't go away the day that you lose your pregnancy.
Absolutely not. So in early pregnancy, the plasma volume is certainly increasing rapidly, and even by the end of the first trimester is increased by about 20%. Certainly the majority of plasma volume expansion occurs later in pregnancy. However, certainly that retention of fluid to expand the circulating blood volume and to facilitate and support the increased cardiac output that's required in pregnancy means that women are retaining a lot of fluid. And the majority of the time they won't realise that fluid has increased and been retained in their body, but it needs to be reversed in the event of a pregnancy loss.
And it does reverse naturally, but it reverses, as you said, at a different time for everyone. But there's a few things that they can do that can make themselves more comfortable.
Yeah, so some women experience the retention of fluid in different ways and might have symptoms such as going to the toilet frequently at night or experiencing some swelling in their ankles or lower legs, sometimes also in their hands and face, but more typically in their lower limbs. And so there are some fairly simple things that people can do to manage those symptoms and to help them to pass. But I think the first thing is just understanding that time is helpful and understanding that it's a normal, natural process, but does have a very varied timeline for the individual. And sometimes that will depend on the gestation at which the pregnancy loss occurs. But certainly things like elevating your feet, wearing compression stockings, doing some gentle exercise such as walking, potentially some gentle cycling, either stationary or on a bike, but also maintaining hydration, because we need to maintain our normal hydration to ensure that our kidneys are working appropriately to help filter some of that fluid out. I think it's also important to just maintain comfort at that period, in that period of time. So providing and getting enough rest, trying to have good sleep hygiene, and wearing comfortable clothes so that as that fluid retention and the excretion of that fluid is occurring, that you're not, also experiencing discomfort that you can potentially manage yourself.
One of the biggest things that I note, and you pulled it out then, is because I'm a continence nurse as well, is when people do start to pee more, they decide they don't need to drink as much. And I think it's really important that we need to encourage people to drink. You don't need to go over the top, like you don't need to have 4 litres a day or anything like that, or those huge drink bottles full all the time, but you still need to drink when you're thirsty.
Even drinking before you're thirsty, so that you're maintaining good fluid intake throughout the day, but as you say, not overdoing it. I think certainly making sure that you're having 1.5 litres or so of fluid a day, plus the fluid that would be contained in other foods and fruits and vegetables and so on that you might be eating. But certainly having water throughout the day can be really helpful. Just making sure that just because you're weeing a lot, that you're not avoiding the input, because that's going to be really important in terms of maintaining good kidney health.
I think really that's what we needed to cover, so people understand that their fluid just doesn't go away straight away. Thank you so much.
Thank you for having me. Hope this is helpful.